Hello everyone, I am Dr. Adityan. Welcome to the series FMGE High Yield. Well, the topic for today is going to be types of oxygen mask. So there are in total 8 oxygen masks over here. So let's look at them one by one. Firstly, we got the nasal cannula. I hope that you can appreciate what a nasal cannula is and how it appears. The main point to be noted is it has 2 prongs. That's the identification point. So there is 2 prongs, each prong for each nostril. Then we got the simple face mask, and simple face mask can be easily identified by multiple holes on either side of the mask. And then we got the face tint. A face tint mask is basically, wait, let me give you another picture. Yes, this is a face tint mask and this is how you wear it. Why do we use a face tint mask? We use a face tint mask when the patient is unable, if he is feeling suffocated or he can't tolerate a tight fitting face mask. Then we need to give them this face tint mask. As you can see that the face tint mask rests on the chin and then there is an open top above the mask. So yes, to those kind of patients, you give face tint mask. And then there is Oximizer. Oximizer is basically a form of nasal cannula, but this has an inbuilt oxygen reservoir and so can be used for high flow oxygen to be given for long term. So Oximizer can give high flow long term oxygen. So in those kind of situations, we use an Oximizer. And then there is Venturi mask. Well, Venturi mask, how to differentiate between a Venturi mask and a simple face mask? It is pretty simple. As I said earlier, a simple face mask has multiple holes on either side of the mask, whereas a Venturi mask has a one big hole on each side of the mask. And we use Venturi mask for the patients who need controlled oxygen percentage. So we can control the percentage of oxygen being given to the patient when it comes to a Venturi mask. And in such scenarios, we use a Venturi mask. Then there is a non-rebreather oxygen mask. This is used in emergency conditions, and this non-breather oxygen mask is given for patients who can breathe on their own. So in such kind of patients, we use a non-rebreather oxygen mask and it should be used in emergency conditions. Then there is high flow nasal cannula. You can see that it is again a derivative of a nasal cannula, but the main difference between these two is that the prongs are similar as to a nasal cannula, but then it has an extra plastic tubing which is not present in a simple nasal cannula. Let me give you another picture. Yes, as you can see over here, a high flow nasal cannula has a plastic tubing attached to it. And through that, you can identify that this is not a simple nasal cannula and it is a high flow nasal cannula. As the name suggests, it provides high flow oxygen. And to such patients, we can give high flow nasal cannula. Then finally, we got BiPAP. BiPAP is an abbreviation of bi-level positive airway pressure. This could be given to, especially this is used when it comes to sleep apnea patients. Let me give you a picture of it. Yes, this is how it will look like when put on the patients, and this is especially most commonly used in sleep apnea patients, and that covers the different types of oxygen masks that we have. So I hope that you can identify them when it appears in the examination. Thank you for watching.